So today we're doing an augmentation nanoplasty with saline-filled breast implants. This is how they come. They're packaged like this. So what we do is we peel it open. And here's the saline implant. And it's kind of neat. It's filled with air. And the air in there lets us know that there aren't any little holes in it, that it's filled. If there were holes in it, there wouldn't be any air in it. So in a minute I'm going to fill this thing up and show you how we do that. So we're doing saline-filled breast implants. You can see I have a little device that I'm going to insert into this little valve. So I'll put this into the valve. I'm going to twist it in there. You can see this implant's filled with air right now. It tells us that it's intact. So now I'm going to pull the air out of that device just by going back and forth like this to remove the air, and in a while I'll put some saline in there once it's inside the body. So you can see how this thing is emptying out. We've already done it to the implant next to it. And now, there we have all the air's out of it. So in a minute I'm going to take this breast implant, this now empty implant, and to get it in, first I'm going to roll it into, so we're in Texas, so I'd call it a little bit of a tortilla. So I roll it up like that, and in a little bit we're going to put that inside. So we're going to start adding saline to this now empty breast implant. So it's going to come through this tubing from a sterile bag of IV saline there. So the saline's not ever sitting out exposed to anything. It's always kept in a sterile enclosed system. So it's never touching. There's never anything in the air getting into the saline at all. So we just kind of pull it into the syringe. Every surgeon has his or her own way of doing it. What we're going to do, of course I'm not going to inject all that air, so let me just get rid of some of that air that just came into there. So I'm going to pull this back. And I'm going to fill this up 50 cc's at a time. So that's how we do that.